I'm Dr. Abdul Wahab bin Abdul Ghani. I am an orthopedic surgeon. I've been working in Ampang Putri Specialist Hospital for the last 16 years. And one of my interests in orthopedics is sports surgery, dealing with sports injuries and how to remedy the problems. Now, if you can look at this model, the knee is made up of the upper end of the tibia and also a sesamoid bone, a bone in the tendon. We call it patella. Okay, so this is a patella, and patella is actually a bone that is in a tendon, and the big tendon here is a patella tendon. Okay, now other than that, you also have four main ligaments in the knee. So let's say we take off this patella, the tendon, and look at the four main ligaments of the knee. We have the one inside here, we call it ACL in short, or anterior cruciate ligament. We have at the back here, which is a bit torn here, we call it PCL, or posterior cruciate ligament. And then we have a broad ligament on the inner side of the knee, we call it medial collateral ligament, and also a more complex ligaments on the outer side of the knee, but simply in this model is quite simplified. We call it lateral collateral ligaments. Okay, so there are four main ligaments, and then we have two shock absorbing cartilage, a semilunar type of cartilage in the knee, one on the inner side and one on the outer side. So this is called menisci, or in plural, or meniscus if they are singular. So lateral meniscus, or the outer meniscus, or the inner meniscus. Okay, medial meniscus and lateral meniscus. So these are the shock absorbing cartilage in the knee. They also increase the surface area of contacts in the knee. So, and then all these are actually covered up with a joint capsule, which surrounds the knee to contain the structures and also the fluid in the knee. Okay, the lubricant to provide lubrication for the joint. Now, all these structures are susceptible to injuries at sports or during sports, and also you can sustain injuries in an accident, even like a road traffic accident or something, or even a fall. Okay. Now, as usual, for the bone you can get fractures. Any bone you can get fractures. For the tendon or for the ligaments, you can get ruptures, either partial or full ruptures. And for the menisci or the cartilages, you can get breakage, okay, or torn meniscus, okay, or menisci. Or the other thing which I forgot to mention, the surface of the bone actually aligned with the surfaces aligned with smooth structure, also called cartilage, but they are specialized cartilage, which is known as surface cartilage or hyaline cartilage. So all the surfaces of the knee are lined with this hyaline, smooth, low friction cartilage. They actually helps to move to smoothen the joint surfaces. Okay, so these cartilages also can get damaged with injuries. Okay, whether in sports or in an accident. Okay, now to all these structures, there are ways of managing their problems. Okay. Now, one thing good about the joint these days is that most of the surgeries can be done arthroscopically. The procedures can be done with minimally invasive techniques, and one of those techniques, we call it arthroscopic, because we actually remedy the damage by putting a scope into the joint and we work through the scope using a camera and also another portal, 1 or 2 portals for introduction of instruments. Okay. Now for fractures, of course, as usual, fractures in the joint must be fixed accurately, and the anatomy of that joint must be restored. Okay. To mimic the original morphology of the joints. Okay, so that's the best. We can do that by fixation, of course, internal fixation using plate and screws and whatnot. Now for the ligaments, we can repair them or we can reconstruct them. Repair means we open up. Let's say if the lateral collateral or the simpler one is the medial collateral is torn, we have to open. We cannot do arthroscopically because these ligaments are outside the knee, so we have to open the ligaments, by making a cut over the ligament, and then repair of the ligament as an open technique. So the repair can be done depending on where the tear is. If the tear is in the mid substance, we can repair by end-to-end stitching, or if it is a valse or detached from the origin or insertion, we can fix it back by using some method of internal fixation like screws or stapling. Now, so are the other ligaments on this side, the lateral collateral. We can do about the same procedures, but for the ligaments that is inside the knee and the injuries are more common, the ACL and the PCL, there's no way we can repair them. Okay, so most of the time we get a mid substance tear, and in such an instance we have to reconstruct the ligaments. We cannot repair them. We cannot reuse the old ligament, but we have to replace the ligament with some other spare parts, taken either from the patient, or we can use other materials or other biological materials like allograft and so on. Now, so that is called reconstruction. Okay. Now for the ACL, which is one of the commonest ligament to get torn, we can either use the patellar tendon, which you can harvest the central third of the patellar tendon, or we can use hamstring tendon, which are situated on the medial, or more specifically we call it anteromedial side of the tibia. We can harvest that, or we can also use allograft. Okay, and these can be done arthroscopically without even opening the joint. Okay, except for the area where we're going to harvest the graft from. Okay, the rest of the surgery are arthroscopically done. Now, damage to menisci can be repaired because, okay, it all depends on the type of tear. If the tear is a peripheral tear, or the tear along the attachment of the menisci to the capsule, that should be repaired. Okay. So now the approach for all meniscal injury is very conservative. We try to restore or repair the meniscus as much as possible. But in an instance where the meniscus cannot be repaired, then we have to cut off the damaged part. Okay, and that will restore motion and reduce pain tremendously.